A great deal of media attention has been placed on chronic traumatic encephalopathy, commonly known as CTE, and rightly so. Awareness for this condition needs to be increased, so if you're a sportsman, fighter or military personnel, please stay tuned as we'll be discussing this after the short intro. My name is Dr. Hart-Pinto, and at JHP Medical we make weekly information videos designed to increase awareness and help you better understand your medical condition and the available treatments. So if you find this video helpful, subscribe, click the notification bell and the like button to support us in helping you. Okay, so what is CTE and who gets it? CTE is a progressive neurodegenerative condition caused by the buildup of an abnormal protein called tau in the brain. The condition is thought to be caused by repeated blows to the head and multiple episodes of concussion. The symptoms of CTE mimic other neurodegenerative conditions such as Alzheimer's disease. However, the onset is usually in a much younger age group. The condition of CTE isn't new. Evidence of the progressive neurological condition was first reported in the 1920s by a Dr. Martland. He gave the condition its first medical name of paralysis agitans. In the early days, fighters and their promoters called athletes suffering from the condition punch drunk. The reason CTE occurs in some individuals is not well understood. However, you are at risk if you're an athlete involved in contact sports, a fighter, or military personnel. The symptoms of CTE usually develop slowly and often can be several years following the head trauma. CTE affects the way the brain functions, and the experience can vary between patients. If you are suffering from CTE, you may initially experience a deterioration in your short-term memory. In this, you may find yourself asking the same question repeatedly because you're unable to recall the answer. You may become easily confused or disorientated, and it may take you longer and be more difficult to make everyday decisions. You may experience an alteration in your mood, where your mood may be lower, you may be more paranoid, or have increased agitation. You may find that you seek to avoid social interactions, and some experience an impulsive behaviour or increased aggression. Over time, as your CTE worsens, the symptoms can also worsen, with some patients experiencing a progressive worsening in their memory symptoms. Some patients may experience a slowing or slurring of their speech, and the development of tremors and slower movements mimicking the symptoms of Parkinson's disease. So how can my doctor diagnose CTE? Unfortunately, current medical science does not have an easy way to diagnose CTE. The changes CTE causes within the brain cannot be reliably picked up on routine scans. And the only way to confirm the diagnosis is to examine the brain after death in a post-mortem. Despite this, if you are someone with a strong history of repeated head trauma and concussions, then your doctor will have a high degree of suspicion for this condition. So, if you're experiencing any of the symptoms we've discussed, it's recommended to discuss your concerns with your primary care physician or your GP. It's likely they will refer you on to a specialist memory clinic or neurologist for further assessment. So what treatments are available for CTE? Unfortunately, treatments for CTE are very limited and no cure for CTE exists. For now, we're limited to supportive care through the progression of the condition. Most importantly is knowing how we can prevent CTE. The best way to minimize your risk of developing CTE is to avoid any exposure to repetitive head trauma. For some, this isn't really a practical solution, as your profession puts you at risk, for example if you're a professional athlete or a military personnel. In these circumstances, you should try to minimize your risk as much as possible by wearing the approved, well-fitted protective headgear, ensuring sporting events are supervised by qualified medical practitioners, ensuring you seek medical attention if you experience any head injury, and only return to activities once you've been cleared by your doctor to do so. Of course, we really need further research looking into how we can get earlier diagnosis for patients with CTE and better treatments. I hope you've enjoyed this video. Don't forget to subscribe and interact by giving us a thumbs up and leaving a comment down below. By doing this, you help support the growth of our channel and our mission to help educate as many people about their medical conditions as possible, and hopefully improve your quality of life. Of course, this video does not provide individual medical advice and is intended for informational purposes only. Do not consider this as a substitute for professional medical advice, diagnosis or treatment. Please don't ignore professional medical advice in seeking treatment because of something you've heard here. If you believe you have a medical emergency, immediately call your doctor or ambulance service. Thank you for watching. See you next time.